Assalamu alaikum, respected doctors. Welcome to my YouTube channel MBBS and BDS lectures. Today on our YouTube channel, video number is 348. Mean 347 same videos are present on our YouTube channel. Now today our lecture is related to general medicine. Now, there are many lectures of general medicine present on our YouTube channel, but today we will study about clinical skills in general medicine. Now, today in clinical skill in general medicine, today our topic is how to take patient history in general medicine. Now, today our topic outline is in history taking is the first is the definition of history, how we will define history. Second is the sequence of history taking, how we take history. Now in a sequence of history taking, first in sequence, the first is the patient profile, are also known as biodemographic data, are also known as biodata. Second is the presenting complaint or chief complaint due to which patient come to the hospital. The third in sequence, the third is the history of presenting illness, and the fourth is the drug and treatment history. And on number 5, there will be past history of patient. And number 6, the personal history or social history, and we will record the socio-economic history also in the social or personal history. And the last is the family history. Now first we start from definition of history taking. What is history taking? History taking is an art that has to be mastered to reach correct diagnosis. Now come to the sequence of history taking. Now today is the first part of history taking, part 1. We will cover the history taking in 4 to 5 videos, but in today, in first part only, we will study the patient profiles, the first heading of history taking patient profiles in detail. In second video we will study the chief complaint in detail. Now the first in patient profile we will study about 4 headings. First is the patient name, second is patient age, third is patient sex, and fourth is the patient address. Now first we start from the patient name. Why? Now first we start from patient name. In patient name, the first is the question, why patient name is important? Now the answer is sometimes we have patients with same name in ward. To avoid misunderstanding, to provide one patient treatment to other patient due to same name, therefore patient name is important. Now first, if a patient is female with the same name but patient is married, we should mention their names and their husband names with her names. And if patient are females with similar name but unmarried, or male patient with similar name, we should mention her or his father name with patient name to avoid the misunderstanding. Now come to the age. Now again we will start from the question, why patient age is important? The answer is because some diseases are common in children and young adults, and some diseases are common in old age. Now first, diseases which are common in children and young adults are, number 1, hemolytic anemia. hemolytic anemia are common in children and young adults. Second is the infective hepatitis. The third is the acute leukemia. And the fourth is the poliomyelitis. These are the four diseases which are common in children and young adults. Now come to the diseases common in old age patients. Number one is the carcinomas. Second is the arteriosclerosis. And the third is the coronary heart diseases. Now come to the third heading up patient profile, sex. Why patient sex is important? Why we should mention the patient sex in history? Because some diseases are common in females and some are common in males. Some are common in males and some are common in females. First, diseases common in females are: number one is the SLE, systematic lupus erythematosus. Second is the myxoedema. The third is the chorea. And the fourth is the calcular cholecystitis. These are the four diseases which are common in females. Now come to the diseases common in males. Number one is the coronary heart disease. Second is the bronchogenic carcinoma. And the third is the COPD. And the fourth is the hemophilia. These are the diseases which common in males. Now come to the last heading up patient profile, address. Again we will start from the question, why patient address is important? Because patient which live in dry and dust areas having more tendency of cough, therefore patient address is important. Now today our history taking in general medicine part 1 is end, in which we cover the patient profile. In next videos, 3 to 4 videos, we will cover the whole history taking. Now we have Telegram channel and WhatsApp groups for you people. If you are an MBBS student, we have a Telegram channel for you by name First to Final Year MBBS Lecture, in which we will daily share notes, books, past papers. And if you are BDS student, we have channel in Telegram by name First to Final Year BDS Lectures. And we have WhatsApp group for BDS student only by the name First BDS group for boys for first year BDS student, and first year BDS group for girls separately for first year BDS girls. And we have a second BDS group for second year BDS boys, and we have a third BDS WhatsApp group for third year boys. For girls we will also create group, and also we will create for MBBS students in future. Now the all links of these channels and WhatsApp group are present in the description of this video. You can directly join by clicking the links below. Now today our topic is complete. If you like my video, press the like button and share these videos with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to you receive each new video notification. For watching my videos, I am very thankful to you. Thank you very much.